Good afternoon. My name is Bertha Rivera. I am doing a nursing presentation on a forensic nurse for my community health class. What is forensic nursing? In 1995, the American Nursing Association recognized forensic nursing as a specialty. The International Association of Forensic Nursing described the field as the application of nursing science to the public or legal proceedings. Forensic nursing has many subspecialties. Among those are sexual assault, nurse examiner, the forensic nurse examiner, domestic violence, the advanced practice forensic nurse, the forensic clinical nurse specialist, the nurse death investigator, the nurse coroner, and also you have the forensic nurse that deals with any kind of mass disaster. All of these subspecialties, one way or another, may interact at one point, whether it's doing neglect on child abuse, sexual assault on child or women or even men, domestic violence, and also on the elderly. The prime activities of the forensic nurse are that the forensic nurses are specialists who work at the intersection of nursing and law. They are liaison between two different worlds and must speak the language of each. They still continue to provide the physical care and the emotional support to the victims, but at the same time they are collecting evidence that may be admissible in court. The scope of practice for the forensic nurse that was established back in 1997 by the IAFN and approved by the American Nursing Association. It focuses on providing patient care, but also on collecting the evidence, on counseling the patients, and of course the communication with the professionals in the legal system. The scope of practice continues as the nurse has to have the skills and a body of knowledge related to the identification, the assessment, and the analysis of forensic patient data. To apply a unique combination of processes rooted into the nursing science and the forensics and public health for the patients. The standards of practice for the nurse are still the same, whether you're a forensic nurse or a regular nurse in a hospital or whatever other title you might have, which is still the assessment, your diagnosis. You have to make sure you have the outcome identification. You still do the planning, the implementation. Of course, you always have to have that evaluation for that patient. The professional performances for the forensic nurse, however, are still maybe a little bit different, but they are the quality of care, the education, professional practice evaluations, the collegiality, the ethics, research, leadership, and collaboration with a whole bunch of other different disciplines, and of course having the utilization for any kind of resources that may be available. The thing with the forensic nurses and its population is that the forensic nurse needs to make the public aware that they are there to help out and help out in any crime may have been committed, and protect at the same time the victims with their civil, legal, and human rights while they're taking care of them, and at the same time gathering information, gathering evidence. They continue to provide a holistic approach to study interventions, physical, psychological, or sexual violence. The forensic nurse still provides nursing care to the forensic patient with a forensic environment while preserving the evidence. So once again, they're still taking care of them, but at the same time, a little bit different than a regular nurse would do, because they know exactly what kind of evidence they would be gathering, and leaving it up to a nurse that might be in an emergency room. They may be able to help some, but that chance of getting anything contaminated for legal purposes might be a situation. So you always have the forensic nurse that has to step in and take care of situations like that. A forensic nurse is also an advocate for the justice and the truth in the case of any crime. In order for a nurse to become a forensic nurse, there's a lot of preparation as far as education goes. First of all, the nurse has to be a registered nurse within the state or territory of the United States, have been practicing for at least 2 years, hold a graduate degree, which would be a master's, a postgraduate degree, a doctorate degree in just the nursing forensic field itself. They need to have at least 2,000 practicing hours minimum on the forensic field, also within the past 3 years only. Also, they should have completed a minimum of 30-hour continuing education on the specialty of forensic nursing just in the past 3 years. In addition to all these wonderful things that the forensic nurse needs to do, they also need to have at least 2 additional professional development categories. whether it's academic credits, in presentations, in publications and research, being a preceptor, and providing professional services to the community. They must be able to complete eligibility requirements on a reliable assessment on the entry level of knowing the forensic field, and they also need to complete at least 40 hours continuing education on the SANE program, which again is the Sexual Assault Nursing Examiner, and it has to be classroom education. Once they've done all these preparations, they are awarded the AFNVC, which is the Advanced Forensic Nurse Board Certified title. That title is good for 5 years, and it requires a renewing each 5 years. The forensic nurse continues to work with other disciplines, other professionals, which again would include anybody that has to do with forensics at crime scenes, lawyers, testimonies, courtrooms. So you have your investigators, you have your coroners, you have the medical examiners, correctional facilities, crime lab directors, law offices, social workers in some cases, and of course you always have your advocates and your activists that help in the community with any kind of crime that may have committed, whether it's a live victim or a victim who might have passed away due to some kind of assault. Some of the skills and abilities that the forensic nurse needs to know or have are knowing the difference between a sexual assault, domestic violence, alcohol-related crime. And in these cases, they have to make sure that they're doing the correct observations, they're documenting properly, and making sure that they're always preserving the evidence. The evidence always being the biggest thing with forensic nursing. And some of these skills continue to include collecting, again, effective sexual assault examinations, identifying and reporting any kind of abuse, whether it's a child, man, woman, elderly abuse, and just knowing what signs are there to know that it is an assault of some kind or a mistreatment. The forensic nurse must have specialized knowledge in professional developments, professional and ethical nursing practices, be able to be good with teamwork, of course, and collaboration. They always have to preserve quality and safety for patients. The forensic nurse at many times may even testify in court either as a fact witness or an expert witness, and at times they might work on both sides of the bench. They may work as a consultant for the attorneys, whether they're defense attorneys or the prosecutors. It just depends on what forensic situation is required. What's so unique about taking this field, well, honestly, is just watching forensic files on television and watching Law and Order's scene investigators that brought me to this topic. But even then, just doing all this other research, it showed how many other subspecialties forensic nursing has. I thought it was just a simple, they do sexual assault kind of thing, but it's not. It's just a continuous, a lot of training, a lot of education, and a lot of ways, and just knowing how to preserve evidence that can save people's lives, that can solve crimes, that can help out children, can help out women, even men who are victims of crime, victims of assault, and of course you always have the elderly. And it's a matter of putting the perpetrator away. So in addition to not just being a nurse, the forensic nurse also has to do a lot of the dealing with the law, and that's always a great thing to know, that there's nurses not just helping out in the hospital bedroom or hospital room, but they can continue forward and go to the legal courtroom and make a difference in life. Here are my references, several references on here, and thank you for listening to my presentation.